We talked about the role of PARP inhibitors in the ovarian cancer world and how PARP inhibitors are new to the game of ovarian cancer, and it's allowing women to have a longer time of progression-free survival, so time in between treatments. Ovarian cancer patients are about 85% of them are going to reoccur, so we talk about how PARP inhibitors can lengthen that time between treatments. The PARP inhibitors have different roles and how they are used. So those who are germline tested and somatic testing are a little bit different. So every ovarian cancer patient, whether they are ovarian cancer, fallopian tube, primary peritoneal, all should have germline testing. Those PARP inhibitors that require that, such as rucaparib in their treatment settings, would need to know if they're BRCA positive or if they're BRCA negative. That also will then lead to somatic testing. So somatic testing is actually testing the tumor itself. So the difference between them would be that the germline is what we are inherited from our parents and that what we can pass down to our offspring. The somatic tumor, or the somatic change in the tumor itself, is not inherited and it cannot be passed on. So some of the PARP inhibitors require a genetic marker and others do not. Well, absolutely. With new treatment, there's always challenges, right? And we need to know the side effects and we need to know them well. We need to have the patients who call in understand. And then I think that is helpful when you set some realistic boundaries and some realistic guidelines with your patients. We need to know what anemia is. We need to know what's causing their anemia. We need to know how tired they are. If the nursing can play a role in that, our ultimate goal is to keep patients on medication. So if we can fix the small problems and keep our patients on medication, that's going to be the best outcome for everybody. We have multiple indications for our PARP inhibitors, but ongoing research is telling us, do they work better with, say, different medications? Do they work better with an immune medication? Do they work better with bevacizumab? And some of the ongoing treatments will tell us that, and the ongoing clinical trials will tell us that. We're also wrapping up a few of our clinical treatments. The Javelin 100 PARP will give us some great information that tells us, doing PARP with active chemotherapy, is that better? Or is doing PARP after chemotherapy, is that better? So learning where PARP inhibitors and finding their sequence is our next goal. In traditional settings, patients are in an infusion suite and they are either there weekly or they're there every 3 weeks. A lot of lab abnormalities, a lot of lab assessments. Compared to PARP inhibitors, which is a medication, depending on the PARP inhibitor that you choose, you can take twice a day or just once a day, depending on how your clinician describes it or prescribes it. Traditionally, we have time, right? Because ovarian cancer patients reoccur. And what we ultimately want is quality time with family and friends. So the ability to take a pill at home, rather than coming into an office or a clinic or a hospital setting, that to me is wonderful. Giving patients time with their family and friends is exactly what we want to do. And oral therapy is very, very new to the ovarian cancer world. So educating not only nurses, but clinicians and patients, because patients are hearing these, advertised on television, their friends in their group chats, and they want to know, how come I can't be on this medication? So education for not only patients, but also for the nursing staff as well helps. I think the take-home message is that listen to your patients. Our patients want to be on these medications. They want to live. And the ability to offer them maintenance without being in our infusion rooms or in our offices and allowing them to continue to live their life, not only be alive, but to live their life, is one of the greatest gifts we can really offer them.